Last, we had talked a lot about treating post-surgical patients and the certain red flags that we should look for when treating these patients. My patient is a 53-year-old female status post a left meniscus repair. She arrived in the clinic 2 days post-surgery since she had her surgery on a Friday. The patient demonstrated antalgic gait, had used a crutch, decreased knee extension, knee flexion. Her pain was at about a 6 or 7 out of 10, and she also had decreased left gross lower extremity strength. The patient had had her right knee done a few years ago, so she was very aware of the process of therapy, what to expect, what she was going to be doing, and how she was going to be feeling. Prior to the surgery, the patient was very active, was running 10 to 12 miles a week, was walking 1 to 2 miles a day, liked to go boating, and was really anxious to get back to those activities since her grown children were home for the summer, and she really wanted to get back to doing things with them. On the first day of therapy, we did some assistive active assistive range of motion, such as heel slides on with a towel on the plinth, and also just some passive range of motion in order to increase that knee extension and knee flexion. We also did some non-weight bearing strengthening exercises on the table until she was able to progress into weight bearing exercises. So she had been doing really well. She was so active. I could tell she had been doing her exercises at home, so she was progressing very quickly. Until one day, maybe our fifth or sixth session, she came in with increased calf swelling. Her pain had shot back up to a 6 out of 10. So the first thing that came to my mind was maybe a blood clot. Because of this, we did some special tests, my CI and we had kind of decided that a blood clot is a possibility. So we sent her back to her doctor where they performed an ultrasound. Thankfully, it was negative. There was no blood clot, but it led to a discussion between my CI and I of where we had gone wrong. We come to the conclusion that I had progressed her too quickly through her exercises. She'd been doing so well, tolerating as to what I thought very well, but I was not giving her muscles or her body time to recover and relax from the new exercises that we had already added. We were adding one or two. She was doing great doing them at home, coming in, let's add two more, let's increase the weight. And that was really doing some damage to her body. Her muscles weren't ready for it. She was no time to recover because she was performing her exercises so well at home. And then it also led me to be able to practice my education skills. So I had to explain to my patient, we have to do this way because we don't want you to hurt. We don't want this to affect your body. We don't want it to regress. So we dialed back her exercises, symptoms decreased completely, and we were able to progress her in the right way. But it was a really good opportunity for me to look at how I progress my patients and also my education skills on the pathology and anatomy behind my patients' injuries.